Welcome to Physiomedics. In this video, we will discuss foods you should avoid if you have hypertension. High blood pressure, often referred to as hypertension, is the pressure at which blood flows from your heart through your blood vessels. When blood pressure is consistently high, it can cause problems with your heart or damage your arteries due to its ability to develop without noticeable symptoms. High blood pressure is often labeled a silent killer. High blood pressure is prevalent in the United States, as nearly half of adults currently experiencing it. It is essential that you have regular checkups and discuss any concerns with your doctor to detect high blood pressure early and treat it as soon as possible. Certain foods can elevate your blood pressure or prevent it from lowering to a healthy level. If you have been diagnosed with high blood pressure, it is important to watch what you eat. There are dozens of foods you need to avoid with high blood pressure to maintain healthy levels. So make sure to discuss with your doctor and a dietitian which diet plan is right for you. However, you should generally avoid some categories of food if you have hypertension. Following are some foods you should avoid if you have high blood pressure. Number 1. Deep fried foods. According to one study, deep fried foods such as french fries and fried chicken wings are associated with many health conditions when consumed 4 or more times a week. Fried foods were linked to a higher risk of developing the following conditions: type 2 diabetes, obesity, hypertension, heart failure. Another study found a higher association between prehypertension and hypertension, where participants had a high intake of fried foods compared to those who did not consume fried foods. Some fried foods to avoid include fried wings, french fries, and potato chips. Number 2. Saturated fats. Saturated fats are commonly found in many popular American foods. Research supports reducing saturated fat intake, which has been linked to increased systolic and diastolic blood pressure. Another study revealed that while diets high in saturated fats saw an increase in blood pressure, diets rich in polyunsaturated fats, such as from fish, walnuts, flax seeds, and sunflower seeds, help prevent blood pressure elevation. Common saturated fats to avoid include desserts, such as chocolate, cake, pies; full-fat dairy products, such as yogurt, milk, cheese, cream. Number 3. Red meat. Although red meat is often recommended as part of a healthy diet due to containing high amounts of vitamin B12, zinc, protein, and other essential nutrients, it can also be dangerous if consumed in large quantities. If you have high blood pressure, research shows that 9.8% of people with hypertension and 37% of people with prehypertension consume red meat regularly. One study reviewed 97,000 cases of high blood pressure found a positive association between red meat consumption and increased risk for high blood pressure. The review observed a 14% increased risk for every additional 100 grams of red meat consumed per day. Popular red meats to avoid include beef, pork. Number 4. Sugar. According to research, evidence from several studies and experimental trials has indicated that added sugar, particularly fructose, boosts heart rate and plays a role in inflammation and insulin resistance, while also increasing blood pressure and its variability. Another study reported that the consumption of sugary drinks and foods, such as in standard American diet, is associated with an increased risk of high blood pressure in older women especially. Popular sugary foods to avoid include prepackaged meals, granola bars, drinks such as soda and fruit juice. Number 5. Salt. American Health Association journals report that high intake of both sugar and salt directly increase high blood pressure, both systolic and diastolic. A study exclusively on sodium salt found that reducing salt intake by a moderate amount lowers blood pressure. The report recommends a daily salt intake of less than 5 to 6 grams to see the most benefit. Popular salty foods to avoid include canned soup and canned meat, cold cuts, potato chips, and salty snacks.